Ready?
I think I just hit admit as well. All right. Welcome, welcome. We'll let people come into the space and get situated here. Excited to see you all. As we're letting people into the space, feel free to type into the chat your name, the organization you work for, any other important information you want to contribute to us, give to us. Sometimes I like to ask to put into the chat the color that represents your mood today.
Nice.
Really doesn't mean anything because that color is only meaningful to you, but it gets us to check in with how we're feeling today. Love it. Pink. Thank you, Paula.
Great color.
And where's the Mandolin Foundation? Paula?
Sorry. We're in Green Bay, Wisconsin.
Oh, nice.
Yeah.
Great. I'm going to go to your site and check you out.
I was writing it down too. Thank you for sharing.
Yes. Yes. Let's see if there's any other brave souls that want to put any information to the chat. Oh, here we go.
Oh,
we have West Virginia, rainy blue today. Brian's feeling the sunset. Oh, sunrise and set colors. I like that. Both ends, bookends to your day. Thank you, Nicole. Today is blue. I think we'll have blue skies at some point here in St. Paul, Minnesota. That's where I live. It's been a lot of gray skies up until today. And Anne Marie, where is the Serenity House?
Hi, everybody. Anne Marie here from Loudon Serenity House. We are in Northern Virginia, about 30 miles west of DC. And we're sober living residences. We have two, a men's house and a women's house, and we're about to open an RCO.
Congratulations.
Thank you.
Yeah. Well, and remember, we accept requests for technical assistance. That's my area of expertise. So if you need any more tailored support, certainly reach out to us.
All right. Thank you.
Great. Well, we are at 12:03, so I think what I'm going to do is just go through our opening slides, and then I'll hand it over to Brian and Emily to take it away, and we can do part 2 of strategic planning. So I will share my screen here. And can everybody see that? Looks good. So again, welcome to session 2 of Appreciative Inquiry Approach to strategic planning. We're going to spend some time together, about 90 minutes together this afternoon. And like I said, Emily and Brian will be our facilitators today. And this is just our funding disclaimer that this training was made possible through a SAMHSA grant, and that the views expressed both verbally and within our written materials do not necessarily represent the official policies of the Department of Health and Human Services. Always, 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 if we want addiction destigmatized, we need a language that's unified. So the words we use matter. We never want to describe somebody as their disease or diagnosis. They're a person first. And just like I mentioned a couple minutes ago to Anne Marie, We do offer more tailored technical assistance. And so what that means is that hands-on support you might need in implementing peer support in your organization, or you're looking for some trainings for the peers you have on staff, or you need some help building capacity in your recovery community organization. So through our website, you can submit a request for technical assistance. Someone will reach back out to you and get you in touch with one of our team leaders. And then they'll reach back out to you and we'll have a conversation about how can we help support your organization or address your needs. Couple housekeeping notes. So the presentation today is being recorded. We will be making it available to the general public at a later date. When you're not speaking, please mute yourself, but do feel free to unmute and respond to questions from the facilitators. If you can, when you unmute, please identify yourself by just saying your name and where you work. Feel free to submit questions in the chat, and Cindy and I are here to go through the chat, and we can always pause and address something there. I did send out an email last week with a kind of summary of session 1 and then some links to the materials. So the workbook, a PDF of the PowerPoint presentation. And then at the end of today's session, we will ask you to click on a link to do a very short evaluation that lets SAMHSA know how we're doing, if you enjoyed the presentation, and any improvements we can make. And I think that's where I lead off. So I'm going to leave off. So I'm going to stop sharing and hand it over to our wonderful facilitators. So Emily and Brian, take it away.
Thank you, Chris. So, welcome back, everyone. Brian, just let me know, are we going to start with, let me get to the slideshow.
Let's pause for a moment and there may not have been some of you that were with us last week. So what we'll do is, Emily, if you'll just, pause there we go. Stop the sharing just for a moment. And so we'll just talk with our folks here before we jump right into the PowerPoint.
Sure.
All right. So thank you for joining us again, especially if you were with us the previous session. And we want to make sure that we address everyone, although you may not know each other or work with each other. This type of information or this process can be used whether you're working with one organization or you're working with a group of people. And so we just wanted to clarify and go over a couple things that we discussed last time. So the importance of appreciative inquiry and using a strengths-based approach is how we do the work at Georgia Council for Recovery. And everything that we do, we want to start from what's working and move forward from there. And that is a big piece of the appreciative inquiry mindset, is understanding that there are things that are working, whether that's within an organization or a system or a group of people or yourself, that you can use. And there are things from the past that we want to use and move forward, but we want to make sure that those are the best parts of the past. And so as we do that and we go through this work, we just want you to know how important it is before you jump and do all of the practical logistical steps, that you understand the process of defining who you are and our purpose and our why and what we use as our mission, and reiterating that, making sure that we stay true to that as we move forward and do this work and using the strengths-based approach. So if you weren't with us last week, real quick, I'm going to jump on just a couple slides so that a few people may follow along with us. And this is just a quote from Wayne Dyer, and we believe that it is really relevant when it comes to AI. As one of the assumptions of appreciative inquiry is that our intention creates our reality. And so we want to be intentional about this work that we're doing as we move forward through this appreciative inquiry lens. And so if you're not familiar, appreciative inquiry uses a 5D cycle of just a few different steps. So what we did previously is we defined, what is the inquiry? What are we trying to achieve? What is our purpose? What is our why? and then discovering. So we began to appreciate the best of what is. We talked about a personal experience, and we're going to dive deeper into that. And that was a little bit of your homework. And hopefully for those that were present with us last time, you were able to do any of your homework. And if you want to go ahead before Emily jumps in and takes over, just drop in the chat if you were able to write any of those core strengths down and some of those things that you will not tolerate within your organization or yourself. And then moving forward today, we're going to talk about dreaming and designing. We're not going to be able to get into the destiny of creating. Sometimes destiny is used, or deploy, as in you're taking this and now you're going to deploy or implement in the work that you do. But hopefully you will be able to take a piece of what it is today, because we're giving you some practical steps to then move forward within your own organizations or yourself as we do this work. So Emily, if you want to go ahead and then share, and we'll ask a few folks if they were able to join with us last time. And if you weren't able to join with us last time, we'll just tell you about the process, but hopefully we'll be able to hear from a few folks about what y'all were able to accomplish from our previous session.
Yeah, so the homework, thank you, Brian. And the homework, we had 2 homework assignments, but the one I want to touch on first is coming up with some core values for your organization. And so what we start with is things we will not tolerate. So for example, some of the things that I personally won't tolerate are lying and unethical behaviors. And so one of my core values is integrity, right? And one of the core values of our organization, the Georgia Council for Recovery, happens to be integrity. So what I'd love to, for now, because we have about 36 participants, I guess 34, not including Brian, well, 33, not including Chris, Brian, well, 4, okay. Anyway, you know what I mean. So, so we have about 32 participants. I'd love for you to unmute yourself and tell us things that you won't tolerate, or if you'd like and you feel more comfortable, please drop those in the chat. But what are some things that you came up with that you will not tolerate, either personally or professionally, or both? Who would like to share?
Hey, Em, could you move to the next slide, I think?
Yeah. This
Or
one?
no, further ahead to isn't there a slide that mentions about what you will not tolerate after step 2?
There it is.
There it is.
I was on the wrong one. I'm sorry. Sorry about that, y'all. So again, so these are some what we will not tolerate examples, and then core values that align, that you take that what we will not tolerate and flip it, and that can become what a core value. And we did this for CARES, and in your workbook you'll see that some of the core values that we hold for CARES are hope, wellness, diversity, recovery, integrity, and commitment. So let's see what you guys come up with. And would someone like to unmute and share things that you will not tolerate? Did anyone take a stab at the homework? I think we have some stuff in the
Hey,
chat.
Emily. This is
Hi,
Courtney.
Courtney. Hey, how are you?
Hey, I'm good. I put lying and discrimination.
Excellent.
So I guess, yeah.
Awesome. Okay, so if you flip those around, lying and discrimination, what were some of those important core values?
It looks like integrity and diversity, equity, and inclusion.
Beautiful. Fantastic, Courtney. Thank you very much.
You're
And we
welcome.
have some in the chat as well. So discrimination again comes up, disrespect and stigma associated language. Thank you, David. Dishonesty, shaming, and gossip from Dominique. Disrespect, harassment of any kind will not be tolerated. That's from Robin. Thank you. Lying and not putting in effort. I love that one. Paula, thank you. Cindy said office politics. Jenny shared poverty shaming. I love that one. Okay, and then let's see what else we have down here. We've
We have
got,
John
yeah, go ahead,
has
Brian.
hand raised too. If John, if you feel like
Please.
unmuting and chiming in as well.
Sorry, unmute. Hi, I'm John. So for me, it was people who are going to come on and just be in it for themselves or not consider how to work together. So the value I got out of that was unity.
Unity. Oh, what a great core value.
Yeah, I love that. Collaboration is key.
Wonderful. So let's come up with some core values based on some of these things we will not tolerate. So we've talked about diversity, equity, and inclusion. We talked about integrity. We talked about unity. What are some other things that you guys would like to share in terms of your core values? Who else wants to? Empowerment. I love it. Empowerment.
And as you're thinking about this, if you were here with us last time, and or if you weren't, it's so key and important that we start with our purpose, understanding who we are, our why, and what things that we want to keep true to.
I'm writing these. Yeah, and I'm writing these down, folks, so we can keep track of them. Hospitality and acceptance, hope. These are fantastic. Hospitality.
Hello, this is John Wright. I've got an addition.
Yes, please.
I would say leadership development.
All right.
I'm just kind of jumping to the conclusion on there in terms of what I want to see.
That's
fine.
fine. That's fine, John. Thank you very much. That's what we're here for. Good listening skills, leadership development. Love it. Discipline. Fantastic. All right. So thanks for everyone for participating. And I think you get the idea of where we're going with this. Brian, I'm going to go ahead and flip to the next slide. That be all right?
You know what? I'm just gonna, I hope it's okay with you. I'm gonna take over and
Go ahead.
and jump back into. So if you don't have the workbook, hopefully you can access it later on. It's not crucial that you have it, but because I'll share a little bit of it as we're going along through these steps. So I know that if you were with us last time, bear with me, but if you were not, okay, so real quickly, again, we shared about Georgia and how we move into the appreciative inquiry work. We engaged in a purpose question. So to ground us in who we are, what's important to us, to our organization, how we believe that why is it important for us to do the work that we do for ourselves, for our organizations, for the world around us. And we talked about a high point story. Now, today, we moved into just now what we will not tolerate. And generally, you're going to do this all at one time. It's best to make this process happen succinctly in a day period. It can happen over extended period times, and that's okay. But we were using the time that we had allotted the best way that we could. So ideally, what you'll do is you'll start with the purpose question. You'll start with that high point story. And I'll move down for those. Here's our purpose question. What is it about helping to shape the future of recovery community organizations that gives you a deep sense of purpose, meaning, fulfillment? Now, we know it does not have to be curtailed to recovery community organizations. Please take this information and change it to what it fits, whether it's your system or recovery-oriented system of care, your particular community or organization, and adapt it for your own work. It's universal. It can be used for-profit companies, nonprofit. And then we kind of skipped over this, and so we'll come back to that in just a moment. But ideally, what you would do is take and assign the roles and decide who's going to be a part of these group discussions as you move forward, and curtail out what it is that you want to focus on for your strategic plan.
And you know what else, Brian, just real
Yeah.
quick, I just wanted to, we can also send you a list. If you do decide you want to do this with your organization as an in-person activity for strategic planning, there are actually some items that will actually help facilitate this. So things like a large Post-it notes and small sticky notes and some things like that, and markers and such. But we can get you a list of those materials as well. And please let us know if that is something that you're interested in knowing. Go on, Brian.
You're able to do this virtually, and in those cases, you could use programs like Padlet or something to track notes in real time, or you can, if you're in person, use large flip sheets and flip charts, and then Post-it notes as well. So you'll see that in just a moment on the slide. Thank you for pointing that out, Emily. It is nice. It's awesome to see this happen in person, live in action. And then from today, what we're going to do is putting this stuff into action. We reviewed some of the homework just a moment ago, and we're going to talk about those positive core strengths that we wrote down, and then moving into building out a strategic initiative with your organization or yourself if you want to do that. Okay, so I'm going to shift and jump into how we would do this in person as well before we jump into the actual work itself. So again, we're starting with our purpose. And we believe, I like this quote. So when you're surrounded by people who share a passionate commitment around a common purpose, that anything is possible. And we'll engage in that purpose question to ground us all and make sure that our heart's in the right place, because I am not immune to the fact that I can get burnt out on doing this work and getting behind the computer and all the conversations and phone calls, and sometimes it's heavy work too. But to know and bring ourselves back to our heart about why we got into this work and why we're doing this in the first place to help people get and stay well is always important, so that we can collectively come together and, as John mentioned, stay in unity.
Yep.
Then we'll journal that high point story and strengths like we did previously. Now, in person or virtually, you can do this with a Padlet or just having people write them out on their own. That you would write down those strengths on some Post-it notes, and then write one strength per Post-it note with a Sharpie, so that when they go to their group and you go to assign roles, that you can put all of those strengths listed up on each of their group. Now, in their group, what you would do, and you can refer to your workbook or look here at the slides as well, when you're assigning roles, we need somebody that at the table that's going to help keep track of time, so that we can do this in a fast form and fashion, because to see this in real time, real action, like it's happening quickly. Okay, so, and you want that to happen. You want to make sure that you're not just coming together to have a meeting, you spend a few hours together and nothing's accomplished. We've done that plenty enough here. And so we try to be more intentional about our time together, especially when it's hard to get a lot of people in a room together that are from various parts of your state or your community. You'll have a discussion leader, keep people on track. And then a timekeeper to make sure that, hey, we're keeping on track with our time, and monitors the reports out so that everyone has an opportunity to talk. That's the one primary goal of this work, is that everyone's voice is heard. And so we want to make sure that happens. A recorder, which is important. So hopefully people are writing down individually some of the stories that they hear, and the strengths from those stories. A reporter speaks back for the group if there is an opportunity to present, which ideally you would take what you come and work together and then bring it back to present. So then you in your groups. So real quick, this part is very important. Enrolling people in the process so that they understand what it is that they're about to do when they go into their work is very important. So you go over this as quickly and as succinctly as possible, so that when they break into their groups, they're prepared to do this work. They'll each share that high point story from the workbook that they had written down and journaled themselves. Skip over this part because we've already done it essentially in person. And then step 2, they listen. The group members will listen for the ideas, the strengths, and the energizers. And then start slapping those guys up there on the Post-it sheet, or if you're doing it virtually, that you are intentional about sharing those in the chat or somewhere where everyone can see those. The great thing about Padlet, the program, is a great way to theme if you're doing it virtually. Now, if you're in person, obviously that's a lot easier, because then you can take those little Post-its and start theming them together. You'll hear a lot of people had written down the same things like honesty and truth or integrity. Those are things that might show up a lot, or passion and empathy.
Leadership.
Yeah, Emily?
And leadership.
And
Yeah.
leadership development, and whatever those different key themes are, we'll try to narrow it down to perhaps maybe 4. So we start theming those out, and then you find the top 3 to 4 positive core strengths, and then that's where your focus is. And so this is one area where we can share back on with our group before we dive into some deeper work. So participants return to the main group, and you'll capture your favorite values and strengths as a large group. This is just funny. We took a break here. It was time to eat at that point. So you try to get as much accomplished in the first portion of your day before you jump into this next piece of action planning. So intentionally setting up your purpose, knowing who you are, what you represent as an organization, as a unified group of people that are working towards a common goal. And then from that, then we'll jump into the process of creating participants working towards strategic initiatives and an action plan. And then we'll present those. So, well, what does that look like? So going back to the workbook, first, let's talk about some of those positive core strengths. If you can look back at your high point story that you created, and if you had hopefully done so, that some of the things that we would ask is to journal some of those positive core strengths for our homework. If you were able to do that, that's really great. If you didn't, just look back right now at the high point story and see what you had written down. And if you weren't with us previously, maybe you can just take a look at this right here. If you think back to a time where, I'll show you really quick what the question was. Think back for a moment about your experiences utilizing, whether that was a recovery community organization or a recovery-oriented system of care or something that was helpful and beneficial to you. What have you experienced or witnessed at that system at its best to powerfully impact a peer or yourself in the community? And this story could have been your own or someone else's. And what made it an amazing experience? And what did you bring to this moment? And as you're thinking about that, what was it? Maybe it was some of those things, that some of those values that were mentioned. It could have been that somebody was compassionate, that they were honest, or a variety of different things. So if you would, please share or raise your virtual hand, share in the chat too, maybe some of those core strengths and values that you wanted to list out. So what are 2 to 3 things that you value most about your organization or your group that you want to move forward? What are 2 to 3 core strengths or success factors that enabled your high point story or peak experience to happen? And what are things that you value most about your organization that you want to make sure that we keep or stay true to, no matter how much we grow or change in the future?
And I just want to piggyback off of what you're sharing here, Brian, just as an example, and just because I'm going to pick on Courtney and Kathy because they're here with us from Walton Empowers in Georgia. One of the things that we found in Georgia that's really been helpful with strategic planning and planning in general is to go where the energy already is. And so, like in Walton County's example, there was great energy there around the community and great engagement in the community. And so the idea here is to take what's already working in that community and then organize around it and come up with a strategy to help it move forward and propel it into the future. And that's what they did. They took the steps, the action steps that were necessary, which we'll talk about in a little while. But that's what this kind of process kind of breaks that down into starting where, with what's working and then building from it and using that energy to keep that momentum flowing in a positive, proactive direction. So yeah, so we've got some answers, Brian, Courtney.
I see a little bit in there. Also, Latoya, if you would please email Cindy or Chris, and then they can get that information to you from the previous session. Thank you.
Would anyone like to raise your hand and share on some of these core strengths?
And they could be they could be very similar or the same to your core values that you want to keep as your organization, but it could be a little bit different as well.
And we can pick on people too. So
yeah, we have our first person that joined us, Michael Askew.
Yeah, Michael and Kathy raised your hand as well.
Kathy?
Try to get myself unmuted. Hi, everyone. I'm Kathy. I'm from Walton and Powers in Monroe, Georgia. And I shared on my story of strength about one of our local peers that we got a chance to work with. And we were doing services in the local behavioral health hospital. And that's where she came from. And compassion really came in a lot of different directions. And so I want to say that compassion was really a good core value that we utilized. We also did an empowerment piece. As she began to get well, we had an event last September we celebrate the National Recovery Month, and she shared her story at our event. And so we empowered her to be strong in her own her own recovery and how to share her story, because then she utilized our Respect Institute that we have in Georgia. It showed a great amount of leadership because we pulled her into the fold. We supported her in all of those areas, which is what we try to do on a regular basis anyway, because that's what was done for us. And so, I'm real funny about harassment or people shaming people. And that comes from a personal level because that was what happened to me. And so I catch it when I see it, or I feel like it could be a happening thing. And I think that that's a huge strength for me and for our organization, that because of our lived experience, we have the ability to catch some of the stuff as it's happening to other people, and we get to advocate. So that's a huge thing for us. Advocacy is in our everything here. And so by advocating for ourselves and for others, we were able to show leadership to support this person in their recovery and to help them learn how to support others. So thank you.
Wow, Kathy, that was fantastic. Thank you. I pulled so many core strengths out of that, out of what you shared. You're talking about empowerment and advocacy and compassion. It was just fantastic. And that's just a beautiful example of what's working. So thank you. That was wonderful. Who else would like to share from
They may want to share their also on that same note, we would really appreciate it too if you were able to share your high point story, not just the core strengths that you drew from that. So if there's anyone else that's willing to share a high point story like Kathy just did, and then we'll together write down and give some feedback on some of those positive core strengths.
Yeah, I started pulling them out now. I have them written down. So this is great.
Anybody that was with us last time that may be willing to share about the high point story that they were able to write down?
I don't want to pick on anyone, but I will. It's not beneath me to call on someone. Okay, there we go.
We got a hand raised.
Okay, great. Thank you.
Okay, so my story is as a family member. I have a family member who's in recovery, And I got connected with the Recovery Community Organization through alternative peer groups for my son was a teen at the time. And that's again what got me here now working at a recovery community organization. And I was originally hired as a family program developer. So what I got out of that for me personally, because of course I had a piece in this, right, as a family member, was that I saw how families could get disconnected. I saw how that really had an effect on everybody involved, especially the person who was struggling with substance use. And that I could see that working as a family member was a way to keep families and loved ones connected. Okay, by teaching family members ways that they could interact with their loved one, even though they were living a lifestyle that they didn't approve of or couldn't connect with or whatever. And making sure that recovery is available to everybody in the family, because recovery is just not for people that are using. Recovery is for families too, because they are struggling as well. And finding what those families needed, and a person-centered approach, and talking to these families to find out what do you need to help you with your journey, and using the organization as a way to model and mentor, to be a family coach, just like I would as a recovery coach, a peer recovery coach for other individuals. And basically, to make sure that families have that opportunity to connect with their loved one in a way that's healing. So for me, it was about educating family members, because there's so much that they don't know or they don't understand. Having them advocate for themselves, because a lot of family members don't do that. They hide behind the stigma and the shame, because they're also feeling those types of feelings too. And just remembering that, that's what a recovery community organization is about. It's about community, right? It's about pulling the whole community in, families, friends, allies, everybody.
Absolutely.
So
Thank you.
that's my experience.
Thank you. What's your name? I'm sorry.
Peggy Robinson. Sorry, it says Communities for Recovery.
That's okay.
It
That's
does that
okay.
every time I come in here. I don't know why.
That's
But
fine.
I'm Peggy Robinson.
Peggy, thank you so much. Thank you so much for sharing. Thank you.
Welcome.
That was fantastic. I pulled a lot of strengths out of that.
Yes, I did as well. I wrote a couple of them in the chat: creating connection, educating, support, and being inclusive, making sure that you're person-centered. Emily, did you have any else to chime in?
I did. So I had some that have come up more than once. So I had advocacy, connection, allies, education, person-centered, community, family-focused, healing. I mean, there was so much. There's just so much shared. That was fantastic. So thank you.
So at this point, I'm going to jump a little bit back to something that I had already shared. I'm going to address this question before we do. In this process, you're suggesting how are organizational risks assessed? Dreams often run contrary to actual resource capacity of the organization, liabilities requiring insurance, or some cases insurance not available. We are already getting feedback from stakeholders and implemented person-centered practices and looking for next steps for a more sustainable organization. That you're right. Yes, there are always barriers that exist that we're facing. In this beginning stage of this process, yes, we are dreaming the possibilities of the future as if there aren't any barriers that are holding us back. We understand the reality of the situation is that there are, but if we have the best opportunities available made to us, what could it look like? And we'll work from there. Obviously, we understand that you have to navigate within certain parameters. And so then in this next step, which we'll share, when you get this energy in the room, it's great to bring forth some of that passion and the purpose and then move forward. Like I had hopes, I'm sure that, and I still have hopes, but I'm optimistic at least about those. I know that there are limitations to those hopes and what we can accomplish currently as an organization or as a recovery community, but I have seen us come together and do some things that I didn't think were actually possible, but we've made them possible by unifying and working collectively together. So this next step, hopefully, when you get all these people in the room, it's important to get and share some of these stories so that you can get that energy up and you can think optimistically, because yes, we've dealt with enough barriers and limitations in the past, and maybe that has us jaded to thinking about what we can actually accomplish when we can accomplish more when we bring our whole selves into this process. So when you see all these people sharing about their passion and the courage and understanding and willingness and education and consistency and communication, like it gets the levels up, endorphins. People are excited and running around in the room and sharing and are passionate. And you probably see some fire rekindled that maybe had not existed for some time. And I think that what we have seen in the past has shown that that is very necessary when you're moving forward with this next step of from this core strengths into building strategic plans. Okay, so we start with these common themes that we're all going to keep true to and bring back some of that fire that was there from the past into thinking about an action or a strategic plan. So at this moment, when you've switched to, okay, now we're getting into this practical piece. Yes, Barbara, as you mentioned, that there are some limitations, but something that we know, and it might have been mentioned from a high point story that you're like, yeah, that's what we need to focus on or build on. Or you just know as an organization, what you want to achieve is trying to create some sustainability efforts for your organization. So maybe you're going to focus on a particular strategic initiative around fundraising.
Right.
Or perhaps you want to do some more, as Peggy mentioned, some more education and support for families and loved ones. So that might be a key piece of your strategic initiative. Try to get specific with this. And so what we would ask of you at this time is to think for yourself or your organization that you are a part of or represent. What do you want to work on right now? What do you feel that you can drive forward from some of that passion from maybe your high point story and those core strengths that you can use to help implement this strategic initiative as you move forward? So we want to give you a few moments to think of or write out what your strategic initiative is going to be. And for those that are willing, we're going to have you write out into the chat as well what those are. We're actually want to give you a few more minutes after you think of that to start looking at these next questions, looking ahead. And sometimes it's important to go from the backwards forwards. It's helpful to do that. Yeah. But you may want to think of like, what are those 1 year goals? What are the 2 to 3 action steps of your work that are going to reflect that you're moving towards that goal? Some of those short-term action steps. So over the next 30 to 60 days, what are a few things? Could be 5 to 7 action steps that will show that you're working towards the progress of those 1 year goals. What are those strengths that you shared about from today that you're going to use and leverage as you work towards achieving those goals? And critical stakeholders. So who from your team may be necessary to be a part of this, or from your community that is not a part of your working group there today? It could be a commissioner or a legislator, or it could be another community partnership that you have that you know is going to be important towards achieving the said goal. So again, what we're asking you right now is that you start working on creating your strategic initiative for yourself. Now, the idea is that you're going to get a good idea of what we're then going to take as you can implement for other groups moving forward. Chris?
Yeah, thanks. I just wanted to remind folks, I've put it in the chat a couple times, but there's a link to a landing page on the Peer Recovery Center of Excellence website that has all these materials that we're discussing, as well as the recording of session 1. So if you just scroll back in the chat, I've put it in there 2 or 3 times. So if you're looking to download these forms or the PowerPoints or any of that, you have access to that link, and that's where the information will live in perpetuity. So thank you.
And I just wanted to address Barbara's comments about how to work from risk assessment and needs in the that the organization is focused on. And again, so anytime that we're doing this process, we can take that and flip it into what's, start with what's actually working and then building from it. But it is important to look at things from our perspective, as opposed to doing a needs assessment. We usually start with what's called a SOAR analysis, which again starts with strengths. So we start with strengths, opportunities, aspirations, and results. And so those are some things that you can kind of think about in terms of trying to build capacity and work towards some of the things that your organization really wants to focus on. And there are some other tools and things that you can use for that as well. But again, I mean, we really try to take this appreciative inquiry approach and focus on the assets rather than the deficits in any situation, and then build from that, or as opposed to focusing on what we don't have. What do we have that we can build from and build with, but the comments are great, and you're valid. Your points are extremely valid, and I know I just wanted to acknowledge that.
Absolutely. I mean, it's important to know what may be some limitations or barriers that may exist within the community. However, when we focus on those, sometimes we get pulled into the idea that we're not going to be able to get past those. And so when we focus on what our opportunities are, instead, we've found it to be more beneficial to those that we're working with. So again, Chris, they've asked for the link one more time. But if you could go ahead and start writing out your particular strategic initiative or idea that you want to focus on over this next year. It could be for your organization, could be for yourself, personal growth and development. What?
I was just going to say, can we ask someone to share, or do we not have time for that?
We can. What we would also like for them to do is start filling out this next, what that 1-year goal is that they're going to achieve when they're working towards, for example, that family support, that the 1-year goal would be that there are 3 additional family programs at their organization or something of that nature. And then, so what are those 2 to 3 action steps that will show that they're working towards that, and 5 to 7 action steps over the next 30 to 60 days towards that goal, and et cetera. This could be done also for one-on-one peer work as well. This is how we first were introduced to this work by someone, a guy named Jesse Harless, who's helped us through this process. And he has an organization called Entrepreneurs in Recovery. And he showed us what he does with some treatment programs or providers, but he's also done this with, and as just like we have with other larger systems. So a recovery-oriented system of care or communities as a whole, and working together, whether you're developing yourself personally or as an organization. So start writing out some of this information, because what we're going to do next is put you in breakout rooms and give you the opportunity to share. So if you haven't started that, I would suggest at least thinking about this or writing a few key bullet points. So it doesn't have to be super detailed, but again, just 2 to 3 action steps that are showing you're working towards that goal. The 5 to 7 action steps, or it could be less, 3, 4, 5 action steps that you're working over through the next 30 to 60 days that you can take. It might be emailing this particular stakeholder that you listed out. It could be that you set up an initial meeting to discuss working towards that 1-year goal. and then what strengths that you're going to use. And then again, those critical stakeholders that you think are going to be imperative to be a part of this process. I had a conversation as you're writing. I'll just kind of just share so y'all can fill up a little bit of time. Had a conversation with Dr. John Noreen here on the call recently, and he's working very diligently at building out the recovery friendly workplace initiative there in Colorado. And so I think that as I'm trying to do the same here in Georgia, or some of the things that I could be working on, or following steps, you know, it might be one follow-up step that I take towards my 1-year goal is making sure that I'm in contact with John Noreen again, so that I know what has been successful, because again, it's not about, it's focusing on what's working. So if something's working somewhere else, then what can I implement here in spite of the barriers that I may face within Georgia to implementing said program. So that's just a take there. All right. We're going to give you, how many more minutes should we give them before we jump into breakout rooms?
No.
Emily, do we have people that are writing or that are actively ready, or are we getting people dropping off the call because they're scared they're going to go into breakout rooms and not have something to share?
Yeah, I don't know. How about we give them the other 2 minutes?
Cindy, I believe we got rooms of about 4 to 5 people, right? And in your rooms, as you're sharing, just try to be mindful of the time. We're going to give you approximately 15 minutes total. But that's going to be, I think that we can probably reduce that to 12. We'll check in on your groups, 12 minutes a piece, 12 to 15 minutes, so that you can quickly go down. Here's my strategic initiative, and here are the things that I'm working on to achieve those goals. The next action steps I'm going to take, the strengths that I'm going to be utilizing, and the critical stakeholders that you want to be a part of it. What may take up more time is sharing why it is that you want to work on that particular strategic initiative. All right. I think we're good. I hope everyone, I can't see very many people, but I think that those that I can see are easing up on writing, which is not very many. So, but if you are willing to share your video in the breakout room, that's great. If not, it's okay too, but hopefully you are willing to share what you have written down. All right, let's go.
Okay. If anyone's stuck alone, I'll come and rescue you. So hang on. Here you go.
Welcome back, everyone. Welcome back. Welcome back. I hope you guys enjoyed that experience. And yeah, so we're going to give you an opportunity to share. Brian, what do we want them to do?
Well, we would love to hear from a few of you, and maybe you had some impactful group conversations, or maybe you were able to connect with some people that are going to work on some similar things, or gave you some feedback about your plan. Maybe they were able to work on some similar things in the past. But if anybody is willing to share, we would really appreciate to hear from 2, 3, maybe 4 of you about what it is that your strategic initiative is. And if you want to give us kind of the game plan, then that would be awesome. Then we have one more final takeaway that we would add after you share this, especially if you're doing this group work in person or virtually, that not just creating this plan, but the final question that you would want to ask is who's going to sign off to be champions for this initiative? Because it's never good for it to be a one-person show, to trying to run these type of things, especially big projects. And so you want to get, while you have people there energized about this, to sign off that say, hey, that they're going to help implement this as you move forward. If anybody wants to raise their virtual hand or maybe share, or you could just share, if you don't want to share that, share about some of the conversations or highlights from your group work that you would love to give us. Robin?
Well, I can talk about a little about what I spoke about, and mine was increase the educational outreach. And I share with the group that Honor Roan has been in Roanoke since for 30 years this year. We're celebrating 30 years in November, and I've been there for almost 22 of them. And I have very many I'm a trainer of trainers. So the only consistent training I've been doing over the past few years is the peer recovery specialist training. And so I have so many different, I'm a personal medicine coach trainer. I'm a RAP facilitator trainer. I have a peer health and resiliency training. Some of the Georgia trainings, I was actually trained in 2007 in Georgia with my CPS. So, and now I'm a trainer of the Virginia curriculum. So my plan is really to start getting some more of these programs. COVID really kind of stopped everything, as we all know. And one of the things we're going to do is I'm going to sit down. We're a very small staff of 8. And I'm going to sit down with my program manager and try to figure out where we can plug these in so it wouldn't be so overwhelming.
Yeah.
For the two of us who basically run the whole show.
Right.
And we run on grant funding. We take no insurance. We're free services. Everything's free, but our trainings I can charge for.
Okay.
So that's the only additional money that we can use in kind of a non-discretionary way. So we just have to sit down together, put our heads together, and not be afraid to ask for input from other members of our state that I've known over these years, other directors of other drop-in centers, and just kind of throw things around at each other to get some ideas flowing. So it's not just a 1 or 2 person deal. It's asking for help, asking for input from others that may have ideas that will help you. And I've learned that along the way.
Fantastic, Robin. Thank you for sharing. That was really powerful. And thanks for all the work you're doing. That's amazing. You're very busy. Thank you. That's fantastic.
Anyone else willing to share?
I'll share a little bit. I'm passionate about recovery, and I'm passionate about peer support. I have been for years. I first learned about peer recovery in 2011. When I learned about peer recovery in 2011, my executive director had went through the CCAR model, and he brought that CCAR model back to Lucas County, and he introduced me to it. And from that point on, I've been a part of it. And in 2012, I had the opportunity to go to Ohio State and assist in the job duties and tasks for peer recovery support here in the state of Ohio. Nice. So helping to put this together and to see the progress that I see today, this is truly amazing. I'm going to take it another step further. In 2015, I was a part of the advisory group that assisted with the facilitation of telling what we thought about what needed to be added to the curriculum. Of course, it did not always turn out the way that we hoped it would, right, but it progressed, and it did what we wanted it to do, was at least get that progress going, because now it's certifiable. It's a certified, it's a profession. I was asked to in 2017, I was asked to provide that particular workshop for OMAS, peer recovery support, professionalizing peer support, and I did that. Recently, over the past year and a half, almost 2 years, we've been writing a new curriculum for Ohio. I've had to write what is recovery, what is peer support, what is crisis and peer recovery, and all these, and I've been writing these things. My biggest job now is the one that I'm trying to tackle now, which is helping the insurance companies see the valued asset of peer support to connect directly to the recovery community organizations, and not so much use the treatment centers as a third-party payer source, but go directly to the recovery community organization by utilizing peers in the insurance asset that goes down to the recovery community organizations to make that connection secure. This allows both recovery, the social determinants of health, and individuals trying to find hope, health, and security find their own pathway by allowing recovery to be seen as a normal way of operating and getting your life back together. And so for my strategic plan in completing all of this is now going into the treatment centers, preparing something for the treatment centers, because I know that this is going to be happening with as with insurance, because this is a wide thing. This is going to happen. There's no stopping it. So I know this is going to happen. So now it's about helping the treatment providers understand what recovery is. You have social workers coming out of school and they're going right into treatment, but you're going into treatment with the ideology and theology that's historic. Well, what we need is recovery from a today's perspective, because not everybody fits into a mold. So having the newcomers come in that are doing the internships and things like that, having them starting with understanding what recovery capital is all about. So that way, if you're working in treatment, you recognize what recovery capital is, because if recovery is your goal with working with this member, you should know what you're trying to get them to. And that's my take.
Love it. David, that was awesome. Thank you so much.
I'm passionate about recovery.
We could tell, definitely so. I love that next step that you're going to work towards taking. And if there is anybody else that would please be willing to share, be mindful that we're running short on time now. And what we would love for you to do is just try to bullet point each piece of those 1, 2, 3, and 4 steps that you would take, number 1, number 2, number 3, and number 4. So just list out those bullets of the first 3 steps towards the 1-year goal, the short-term action steps, those strengths that are going to be utilized, and those critical stakeholders that are going to be there. Anyone willing to share?
Kathy has her hand up.
I have a hard time doing my hand on this. So hey everybody, I'm Kathy. And I'm from Walton and Powers in Monroe, Georgia. And we had some conversations with, as a group about the nonprofit status. But that's really not what I brought to the table, as we are already a nonprofit. So I'm just going to go over what I have, because I can do that real quickly.
Okay.
So the thing that I had a strategic initiative for was intervening in the jails initiative, and the accountability courts, because that's all wrapped up in one. And the short-term action steps. One thing was and I pulled this from the group, was the advisory board, putting an advisory board in with what we're doing here, taking calls from peers and on our text line, doing a needs assessment, the SOAR, I got that from you, Emily, direct staff and individual roles, which is what we've been talking about today, and preparing a curriculum of recovery support to take in there when I'm pitching my request. And then my strengths, of course, is advocacy. We do a lot of advocacy here at Walton and Powers. My compassion, we have that. We all have that for the peers we serve, and empowering them to reach out where they can, and for us to meet them where they're at, to do some person-centered stuff, and creating connections and working to maintain the ones that we already have. Has been, sometimes we get these connections and they're like, oh, well, what's next? But without nurturing those relationships, those are the ones that are continuing to give back, and we give back to each other, like we do at Walton and Powers with Georgia Council for Recovery. And then I didn't get very far with this critical stakeholders thing, so I could use some help. So I said the sheriff's conversation. In other words, to have one with the sheriff and the jail staff. And that's as far as I got with that.
That's okay. There may be somebody that's a part of the accountability courts, or it could be someone that's on staff, maybe as a peer support provider or an alumni, that you could use as like, hey, that may be familiar with Walton and Powers, to initiate some conversations to go a little bit further, where they can share, hey, how Walton and Powers has helped them. We believe it could be beneficial to other participants. Sometimes that's a good segue.
And a judge, there might be a judge in there that's,
I do have that.
There you go. Right. Yeah. Very well done.
A couple judges that have really been instrumental in supporting, like up in Hall County, in Gainesville, Georgia, has really been supportive of the RCO and the work that for peer support happens up there. And then down in South Georgia, there was a judge that really was the recovery champion behind one of the recovery community organizations that ended up getting started down there.
He still is.
He
He
still
still is. Yeah, it's great. Fantastic. Well done, everyone. Well done. So we're running out of time. Brian, do we want to because we want to have time for questions and answers and for the wrap up, but I didn't know, do we want to?
I think that we can move straight into the questions after just wrapping up, real quickly, as maybe you do this in a group setting where there's multiple groups that are talking about strategic initiatives after you do report outs in a large group setting. So again, appreciative inquiry is bringing all the voices to the table. So you're going to have those opportunities from the purpose or the high point story where people doing pair shares. And then we move into the small group work where everyone's voice is heard. And then we come back and we share it to the large group. Well, when you do that, you're going to have, this could be a section where you might have a small group of people where you're only talking about a couple initiatives. And so it's easy to say, hey, this is what we're going to focus on. We did this with a board of RC, Recovery Community Organization Board of Directors recently, and it was only 2 groups. And they have 2 clear directives that they're going to work towards. But we've also done this with a group of 20 groups before. And it's hard to focus on 20 different groups. There was some overlap in some of the plans, but what you would like to do as a group is choose maybe the top 3 plans if it's a large group. And then again, this was just for your sake, for your purposes of whatever organization or group you're working with, to make sure that you're staying true to your mission and your vision. How do you describe the R in the SOAR acronym? As results.
Yeah, it's results. And so it can be, what kind of results do you expect to see? What are your measurable outcomes that you want to achieve? What results do you want? Like in Kathy's case, what they want to see at Walton Empowers is we want to have a jail program where they have a solid relationship between the jail and the RCO. And I'm sorry, I didn't mean to cut you off there. What were you going to say?
Well, it's sort of like I would describe that as goals then, right? Sort of. Okay.
It could be, but
I was thinking you were talking about outcomes, like, I don't know. I got you. I see where you're coming from.
So the results, I feel like if you're looking at that strategic initiative outline that you laid out, your aspiration could be your 1-year goal. Now, your results could be those 2 to 3 steps that are showing that you're working towards achieving those goals. What's showing that? Maybe you're tracking data that's showing that you're working towards achieving that aspiration.
That was a great question, though. I mean, it really is, and that's come up before. So, does anybody else have any other questions or comments about the information that we've shared, the things that we've covered? I tried to drop some information in the chat.
I will say that I mentioned while some folks were in the breakout room. So if you attempt to do this virtually, hopefully it's a group of people that have worked together previously before, because sometimes it can be a challenge to make sure that everyone is staying engaged. And so you want to clearly lay out like your intentions when you're working together, that people are going to be actively engaged if you're doing this virtually or in person, but especially virtually, because I've done this before too, where I've joined in on a Zoom meeting. I turn my video off and I'm sending emails and stuff. And I know that I'm not trying to call people out on this particular piece. What this is like high level stuff, but when you're doing the actual work, it's really important that you have everyone engaged, especially when you're sharing about your purpose and your passion and some of this mission oriented stuff, to make sure that people are feeling that they are heard. Just like when we're doing the peer work, it's important that people understand that they are heard. So we want everyone to have the opportunity to be seen and heard. And so you would ask people, hey, if you can, please share your video. Please pay attention. Please have all focus in this meeting for this particular session. And then in person, that's a little bit easier to do. You just ask people to maybe silence your cell phones. If you need to, put them away, or try to just send emails on during break or lunchtime. And so sometimes another thing that we've done as we're doing large in-person groups is to be intentional about how you set the room up. So when you're going in to set the room up, you have an area where you just have chairs and seated around, and you may have tables lining the outside of the room. Could have placards for everyone that is registered to attend so that they know that they can set their stuff in this area. So that way, if you're doing any moving around, or also, so there's just not a ton of stuff in the seating arrangement or where the tables are that people are going to be working and engaging with each other. So it's probably less likely that people are going to trip over something or feel like that they have to be grounded to one particular area, or they may even be willing to put their cell phone or their computer back in said spot so that they can be solely focused on what you were trying to accomplish for that day. So being intentional about setting up the room, trying to find a space, if you're doing this in person, where there's good lighting or perhaps even plants. The last time I did a big in-person event, we brought a bunch of plants into the room because, there's science behind that it helps oxygenate the room and people are thinking and feeling better, especially when you're seeing pieces of nature. Sometimes you might just bring pictures of nature to place around the room as well as too.
Yeah. And so just to wrap up, it is all about following the energy of where you are and the work that you're already doing. And then how can you harness that energy and leverage those relationships to take you to the next level, whatever that may be. And it's just, it's an approach to take, and it works. I mean, we've seen it work. One
other thing that I really love about when you're able to do this in person, you can do this virtually. It's a little bit more challenging when you're asking people to present on maybe some of those core themes or values. You'll ask them to get creative and create something and draw. It might be that they draw a heart or something, and they're drawing these different little pieces that show about those core values, and allowing people to be creative in this process is really cool to see. And it's a little different take on just being so very straight focused, because a lot of people are different. Some people want to be creative in their learning style and their process and the way that they do this work. Not everyone is very type A personnel. Sometimes people are out there and like to show that creative side, and we want to create the opportunities to do so. So making sure that when you're doing this in person, you have markers, or you have maybe some materials that can allow people to be creative and expressing themselves.
Thank you, Brian. Chris, do you have anything you want to close us out with? I mean, we have a few more minutes, but wanted to give you an opportunity.
Yeah, well, I just really appreciate the time you've spent with us here today. I appreciate the time that the audience has spent with us. I know it's no easy thing to set aside 3 hours to attend sessions, but it's really valuable work. We've done similar work when I was working at the Recovery Community Organization in Minnesota. I had the great honor of interacting with Georgia a whole lot. And it works. Like Emily said, it works. And so I say, if this is something that interests you and it's a style of strategic planning that resonates with you, give it a shot. It's not, strategic planning isn't one and done. It's supposed to be a living, breathing document. And when we engage our community in this process, the more they want to participate, the more they want to see these dreams come to life when they're invited in during the planning process. So I say just go for it if it interests you. You can certainly reach out to the Peer Recovery Center of Excellence and submit a request for technical assistance if it's something you will need more guidance on. And we can, reach back out to you and figure out the level of support you might need, or if we need to bring Georgia in and do that as well. So lots of ways to continue this work. These recordings will be posted on the landing page for our nonprofit basics series. I've put the link a couple times into the chat, but I'll send it out in a follow-up email. And then just the very last thing for us is the everybody's favorite, but we always ask if you can take a moment and do a evaluation for us. So I'm going to put that link into the chat. Let me see. I don't know. I have to find it here. But we, like I said, we really appreciate everything, the time you've spent with us. And oh, there we go. It's always good to have colleagues who are prepared. So Cindy put it into the chat. You can just click on that link. It'll open a new page, and it'll let SAMHSA know if you enjoyed this training, and let us know if there's any changes we should make.
All right. Do you want us to do the survey as well, Chris?
Sure. Why
Okay.
not?
I went ahead and clicked it and saved it, so I will do it for you.
Perfect.
You can come in, we're done.
Perfect. And
At
I
the
will
end.
send,
Thank you. Yeah, we're done.
I will send out an email after today's session, just kind of with a reminder of all these links, a link to the evaluation, a link to our landing page, and that sort of thing.
Thanks, everyone. Thank you for taking the time. Thank you, Chris. Thank you, Cindy. Thank you, Brian. Thanks for everyone for participating today. I really hope you got something from this, and I hope
the
you
chat-
use it.